My name is Chung, and I'm a hematologist-oncologist at the Prisma Health Institute. I was born in Incheon, South Korea, and moved to the United States when I was approximately 3 years old. I guess I don't have much of an accent. And I moved all over the East Coast, most recently in childhood living in North Carolina. I went to undergraduate at Cornell University, College of Arts and Sciences in Ithaca, New York, followed by medical school at the University of North Carolina in Chapel Hill. And after that, a residency at one of the Johns Hopkins programs in Baltimore, followed by a fellowship at Memorial Sloan Kettering Cancer Center. And I remained on the faculty at Memorial Sloan Kettering Cancer Center on the GI Oncology Service until approximately 2011, 2012, at which time I moved down to Greenville. Many things. Oncology is an interesting field. I was interested from the perspective of family members with cancer, and of course the interest related to trying to help my family members. But from a research and biological standpoint, I'm fascinated with cancers and its genesis, and that led to some of my preclinical and clinical research that I still have ongoing. I feel that I provide a unique, different perspective. As a co-director of the Phase 1 Clinical Trials Unit, we offer novel agents that obviously individuals would not get a potential opportunity for without enrolling in these trials and trying to advance our understanding and therapeutics for individuals. And a lot of preclinical studies that I'm very interested in as well. Based on the breadth of my experience and such, I think I provide a different perspective that is unique. My practice is hands-on. I like to see all the patients, and I like to apply a lot of current information, genomics. I do a lot of sequencing of the tumor tissues and keep up on clinical trials. And of course, to keep up, I'm also part of multiple boards, part of the NCI Colorectal Cancer Consortium as an elected member, as a task force, and in addition to running molecular tumor boards and other activities that really support this increased knowledge that we're learning about cancers and how we can apply this to practice. Prisma Health was a interesting system at the time. It's one of the largest systems in this state, and it has evolved over time, and it provides a good uniform service for the entire upstate. Part of what brought me down here is the members of my hematology-oncology group, Larry Gluck, Jeff Edenfield, are wonderful colleagues that have really established the research and the clinical base of therapy here. And I've just added on to that, and I've become a member of this group. My interest, I have a family, and of course I spend as much time with my family as well. I started late, so my children are relatively young, 7 and 12, but nonetheless they require lots of time. And interestingly enough, my wife is a veterinarian, and part of what also brought me down here is the possibility of owning land and having a farm. And so we live on a farm. We have chickens and goats and other animals and rescue all kinds of dogs. One of the questions is, what advice would you give patients, and certainly questions that they should potentially ask. There's not necessarily a right or wrong question to ask. Often the questions that I received in the academic world were questions in regards to the actual approach, the clinical trials, the data to support that approach, but that's not everything. The individual is also a very important component of your approach in therapy, and this is something that they should ask. Is this something that would be meaningful for me, both in terms of quality of life and survival, and whether or not you're interested in supporting clinical trials to help others in addition to yourself in your treatment. So these are some of the questions that you should ask. Are there clinical trials available? Is the therapy that is going to be offered standard of care, or are there other options, including clinical trials, for consideration? And what are, perhaps for those who wish, more off-the-wall, more out-of-the-box thinking, where genomics might provide some additional therapeutic approaches in addition to just prior experience and contact with other colleagues throughout the world where there may be different approaches that are not addressed. If you'd like to make an appointment to see me, please make an appointment calling the telephone number on this webpage.